You spend nearly one-third of your life lying down. Just think about that for a moment. Decades of your life are spent in bed, in one position or another, while you assume your body is simply resting, recovering, going quiet for the night. Most people treat sleep posture like a pillow preference. Whatever feels comfortable must be fine. Whatever helps you drift off must be harmless. But after years in medicine, and after seeing what poor circulation can do to the brain and the heart, I can tell you that belief is dangerously incomplete. Because sleep is not a time when your cardiovascular system switches off. It is a time when it keeps working, beat after beat, hour after hour, without applause, without rest, without a single pause. And the position you place your body in for 7 or 8 hours can either help that system move blood smoothly or quietly make that job harder all night long. That is the part most people miss. Have you noticed how often people say, "I slept fine, so I must be okay"? I have seen the opposite. I have seen people wake up foggy, dizzy, heavy-headed, slightly off balance, and blame age. I have seen older adults dismiss morning symptoms because they assume nothing serious could happen while they were asleep. But the body does not stop being physical just because the lights are off. After 60, this matters even more. Blood vessels are not as flexible as they were at 30. The neck is often stiffer. The spine is less forgiving. The heart may already be working against high blood pressure, narrowed arteries, or rhythm problems no one fully feels yet. In that stage of life, posture is no longer just about comfort. It becomes a mechanical issue, a circulation issue, in some cases a stroke risk issue, and that is why the direction you sleep in can matter far more than most people realize. One position can allow blood to return to the heart more efficiently. Another can place unnecessary pressure on major vessels. One can support the body's nightly recovery. Another can quietly interfere with blood flow to the brain, strain the heart, and increase the kind of risk that never announces itself with pain first. So tonight, I want you to stop thinking of sleep position as a habit that does not matter. Think of it as an 8-hour physiological decision. In the next part, I'm going to show you the sleeping position I would urge older adults to stop defending, because it may be doing more harm than they realize. Let me say this as plainly as I can. If you are over 60, lying on your stomach is one of the worst sleeping habits you can keep. Why? Because the body was never designed to breathe face down into a mattress. The moment you roll onto your stomach, your neck has to twist sharply to one side just to keep your nose and mouth open. And that twist is not for a few seconds. It can stay there for hours. Now picture a garden hose. When the hose lies straight, water moves easily. But bend it far enough, and the flow weakens. Bend it hard enough, and everything behind that bend starts struggling. Blood vessels are not rigid metal pipes. They are living tubes. And when you force your neck into a rotated position night after night, you can create the same kind of problem. Two of the most important blood supply routes to the brain run through that area: the carotid arteries in the front and the vertebral arteries along the neck. They are part of the highway system that feeds oxygen and nutrients to the brain while you sleep. If the neck is twisted and compressed for long stretches, especially in an older body with stiffer joints and less flexible vessels, blood flow may not move as freely as it should. That is where the trouble begins. Problem: your brain depends on steady circulation all night. Simple mechanism. Stomach sleeping forces, neck rotation, and prolonged rotation can reduce the ease of blood flow through critical vessels. Clear action. If you still sleep on your stomach, that is the first position I would work to change. Have you ever woken up with a heavy head, a stiff neck, a strange sense of pressure behind the eyes, or that foggy feeling that takes too long to clear? Many people blame age. Some blame the weather. Some say, "I must have slept too deeply." But I have seen cases where the real issue was much more mechanical than mysterious. I remember one older patient who told me, "Doctor, every morning I feel like my head is full of sand." He was not describing severe pain. He was describing dull heaviness, neck tightness, and moments of slight unsteadiness when he first stood up. He assumed it was just part of getting older. But when we walked through his routine, one habit stood out immediately. He had slept face down for decades, always with his neck sharply turned to the same side. His body had normalized a position that was asking too much from an aging neck and an aging circulation system. And here is what makes this posture especially deceptive. You can be deeply asleep while your body is under quiet strain. No alarm goes off. No dramatic warning appears. But reduced comfort in the neck, poorer alignment, and less favorable blood flow can add up over time. In some people, that may mean dizziness and mental fog. In more vulnerable people, especially those already living with high blood pressure, atherosclerosis, or prior vascular problems, it may contribute to more serious nighttime risk. So no, after 60, stomach sleeping is not a cute old habit. It is not just the way I've always slept. It is a position that can turn your neck into a bottleneck. And in the next part, I want to show you a second position that seems harmless, but can quietly make the heart work harder all night long. Now let's talk about the position that surprises many people because it feels so normal. A lot of older adults sleep on the right side. It feels familiar. It feels stable. For some people, it is the position they fall asleep in fastest. And because it feels comfortable, they assume it must also be gentle on the heart. But comfort and cardiovascular efficiency are not always the same thing. Here is what most people never picture. Running up the right side of your spine is one of the largest veins in your body, the inferior vena cava. Think of it as a major return highway, a large drainage pipe carrying blood from the lower half of the body back to the heart. Every night, that blood has to travel upward from the legs, the abdomen, the pelvis, and return smoothly so the heart can send it back out again. Now imagine a wide drainage hose with a heavy bag resting on top of it. The hose is still there. Flow does not stop completely, but it does not move as freely. It meets resistance. It slows. Pressure builds behind the squeeze. That is the simple picture I want you to hold in your mind. Problem. When you lie heavily on your right side for hours, the weight of the body and abdominal contents may create less favorable conditions for blood returning through that large vein. Simple mechanism. Blood gets back to the heart less efficiently, so the heart may have to work harder to maintain forward circulation. Clear action. If you already have heart disease, poor circulation, leg swelling, or nighttime chest discomfort, your sleep position deserves more attention than most people give it. I have seen this in older patients who never thought to connect their nighttime discomfort to posture. One man I remember had chronic heart weakness and kept describing an odd heaviness in his chest at night. Not sharp pain, not a dramatic emergency, just pressure, restlessness, and a feeling that he could never fully settle. He assumed it was age, stress, maybe indigestion. But when we talked through his routine, one detail kept showing up. He almost always slept curled on his right side for most of the night. Does that mean right side sleeping alone caused everything? No. Medicine is rarely that simple. But in a body already dealing with heart strain and slower circulation, even a small mechanical disadvantage repeated for 6 to 8 hours can matter. And this is where it becomes more than a comfort issue. Sluggish venous return can contribute to blood pooling in the legs, heaviness, swelling, and that sense of pressure people often dismiss. In the wrong setting, slower, more stagnant venous flow is also one of the ingredients that helps dangerous clots form. That is why I call right-side sleeping a silent risk. It does not look dramatic, it does not sound scary, but in the older heart, it may quietly turn the night into extra work. And in the next part, I want to show you the position many heart specialists consider the most protective of all, the left side. So what is the position I trust most for many older adults? Left side sleeping. If you remember nothing else from this episode, remember that. For a large number of people over 60, especially those thinking about heart health, circulation, and nighttime comfort, lying on the left side is often the most supportive position of all. That is not superstition. That is anatomy. Your heart does not sit perfectly centered in the chest like a statue placed in the middle of a room. Most of it leans slightly to the left. Roughly speaking, a larger portion of the heart's mass sits on that side of the chest. That matters because when you lie on your left side, you are not asking gravity to fight the heart in the same way. You are often placing the heart in a position where the surrounding structures and the major blood vessels are under less awkward strain. Think of it this way. Problem. The heart has to push blood out and receive blood back every second of the night. Simple mechanism. Body position changes how easily that system works with gravity, chest pressure, and vessel alignment. Clear action. For many older adults, Training yourself to sleep on the left side is one of the simplest ways to give the heart a more favorable working position. I have opened chests. I have seen how tightly packed and beautifully arranged the heart and great vessels really are. This is not abstract to me. The heart is not floating freely in empty space. It sits in a crowded neighborhood, so when the body shifts, the mechanics shift too. Now let's talk about the aorta, the main artery carrying blood away from the heart. It curves out from the heart and arches in a way that naturally relates to the left side of the body. When you lie on the left, that geometry can become slightly more favorable, not magical, not perfect, but more favorable. The angle of flow is not working against an awkward body position in the same way it may in less ideal postures. And when the heart gets even a small mechanical advantage, that matters over 6 or 8 hours. Have you noticed how some nights you wake up feeling less heavy, less stuffed in the chest, less sluggish for no obvious reason? Sometimes people credit the weather, the mattress, or pure luck, but posture can be part of that story. When circulation is moving more smoothly, when venous return is less obstructed, when the chest and upper abdomen are not creating unnecessary resistance, the body often feels calmer by morning. That is why some people report they breathe easier, feel less pressure, and sleep more deeply when they settle on the left side. I am not saying left side sleeping is a miracle cure. It will not erase blocked arteries. It will not replace blood pressure treatment. It will not fix every rhythm problem or every cause of poor sleep. But here is what most people miss. Not every powerful change comes in a pill bottle or an operating room. Sometimes the body responds to mechanics, to angles, to pressure, to alignment. And that is exactly why this matters. A small nightly adjustment can quietly reduce strain, support blood flow, and create a more heart-friendly environment while you sleep. No prescription, no cost, no complicated equipment, just a smarter position repeated night after night. I have seen too many people chase dramatic solutions while ignoring the tiny physical habits that shape what happens every single day. This is one of those habits. Sometimes the smallest change is the one that keeps helping because you do it for 8 hours at a time. And in the next part, I want to show you why left-side sleeping may help much more than the heart alone, including the brain, acid reflux, and even the rhythm of the heartbeat itself. Now here is where the story gets even more interesting, because left-side sleeping may help with much more than the heart alone. Let's start with the brain. While you sleep, your brain is not simply off, it is busy doing maintenance. I often describe it this way. All day long, your brain is like a city full of traffic, electrical signals, waste products, and constant activity. Then at night, a cleanup crew moves in. Scientists call part of this the glymphatic system. I call it the brain's nighttime sanitation team. Problem: throughout the day, the brain produces metabolic waste that needs to be cleared efficiently. Simple mechanism. During sleep, fluid moves through brain tissue and helps wash away some of that waste. Clear action. Give that cleanup process the best possible environment by sleeping in a side-lying position, especially the left side when it is comfortable and realistic for you. Why does posture matter? Because position affects how fluid shifts through the body, how pressure distributes, and how comfortably the brain and blood vessels can support that overnight clearing process. Side sleeping appears to support that drainage better than positions that twist, compress, or create less favorable mechanics. And when the brain's cleanup system works better, that matters over years, not just nights. Here is what most people miss. Stroke risk is not only about one dramatic clot appearing out of nowhere. It is also about the health of blood vessels over time. Inflammation, poor circulation, vessel stress, pressure changes, rhythm disturbances, all of these quietly build the ground where bigger problems can grow. And then there is the digestive side, which many people completely overlook. Have you ever woken up with a sour taste in your throat, a burn behind the chest, or a strange, restless flutter in your upper body, and told yourself it was just something you ate? I have heard that story many times. But sometimes it is not just the dinner. Sometimes it is dinner plus gravity plus posture. The stomach sits in a way that generally makes left-side sleeping more favorable for reducing acid reflux. When you lie on the left, stomach contents are less likely to wash upward toward the esophagus. That means less acid where it does not belong, less irritation in the chest and throat, and less of that miserable middle-of-the-night burning people too often normalize. And why does that matter for the heart story? Because the chest is crowded territory. Reflux can create sensations that mimic heart discomfort. It can also irritate the vagus nerve in some people, and that nerve has influence over heart rhythm. I am not saying reflux directly causes every irregular heartbeat. Medicine is never that simplistic. But I am saying this. In a vulnerable older body, repeated nighttime irritation, poor sleep, chest discomfort, and autonomic stimulation are not things I like to ignore. So yes, the left side may support the heart, but it may also help the brain clear better, help reduce reflux, and help create a calmer internal environment through the night. And in the next part, I'll show you exactly how to train your body to sleep this way, even if you've spent decades doing the opposite. Now let me be honest with you about something. Changing a sleep position after decades is not easy. If you have slept on your stomach or right side for 20, 30, even 40 years, your body has built muscle memory around that habit. Your shoulders expect it, your neck expects it, your brain expects it. So if you try to force yourself into a new position all at once, you may feel awkward, restless, or frustrated. That is normal. Problem: your body is trained to return to old sleep positions automatically. Simple mechanism. Muscle memory pulls you back to what feels familiar, even if that position is not ideal. Clear action. Instead of forcing change, guide your body gently using physical support. Let's start with the simplest and most powerful tool, a pillow behind your back. When you lie on your left side, place a firm pillow snugly along your back, almost like a gentle wall. Not loose, not sliding. Firm enough that if your body begins to roll backward in the middle of the night, it meets resistance. That pillow becomes your silent coach while you sleep. It keeps you from drifting into right side or back positions without waking you fully. I have recommended this to many older patients, and the feedback is often the same. Once I placed that pillow behind me, my body stayed where I put it. Next comes the pillow between your knees. This one matters more than people think. When you lie on your side without knee support, the top leg tends to drop forward. That twists the hips and pulls on the lower spine. Over hours, that small twist can create pressure in the lower back or tension in the hips. And discomfort is the fastest way to abandon a new sleep habit. So here is the fix. Place a soft pillow between your knees. Let it hold your hips in a straight, neutral line. Think of your spine like a stack of blocks. When those blocks stay aligned, pressure spreads evenly. When they twist, strain builds. That small pillow can mean the difference between discomfort and deep sleep. Now let's talk about head position. You do not need to sit upright in bed, but a slight elevation of the head can make a meaningful difference. Aim for a gentle incline, not extreme, just enough to support breathing and reduce strain on the upper chest. A well-positioned pillow that keeps your neck neutral, not bent forward, not tilted backward, helps keep airways open and reduces tension across the shoulders. And remember this, the goal is comfort, not perfection. You are not trying to punish your body into a new posture. You are teaching it a safer one. Here is the simple 3-night plan I often suggest. Night 1. Start the night on your left side with support pillows in place. Do not panic if you wake up in another position. Just reset when you notice. Night 2. Repeat the same setup, but focus on how your body feels when you first wake up. Notice your neck, your chest, your breathing. Night 3. Your body will often begin accepting the new pattern, not perfectly, but noticeably. And in the next part, we'll talk about what to do if left side sleeping simply isn't possible for your body, and how to create a safe alternative. Now let me make something very clear, because good medicine is never one size fits all. Not everyone can sleep on the left side comfortably. I have treated patients with shoulder arthritis so painful they could not tolerate pressure on that side. Others had spine conditions, severe hip problems, or breathing disorders that made side sleeping difficult. Some people with advanced lung disease or certain heart conditions feel more comfortable in upright positions. So if left side sleeping feels impossible for your body, that does not mean you are doing something wrong. It means we adjust the strategy. Problem: Some bodies cannot tolerate left-side sleeping due to joint pain, spine issues, breathing limitations, or other medical conditions. Simple mechanism. Discomfort leads to restless sleep, frequent movement, and poor recovery. Clear action. If left-side sleeping is not realistic, the safest alternative for many people is supported back sleeping, done the right way, not flat, not collapsed into the mattress. Supported. Start with head elevation. Raise your upper body to about a 30 to 45 degree angle. This can be done with a wedge pillow or by stacking pillows in a stable way that supports the neck and shoulders together. The goal is not just to lift your head, but to lift your chest slightly, helping breathing and reducing strain across the upper body. Next, place a pillow under your knees. This is one of the most overlooked steps. When your legs lie flat without support, the lower back often arches and tightens. Over hours, that tension can pull on the spine and create discomfort that wakes you up or makes you shift into less ideal positions. A pillow under the knees relaxes the lower back and keeps the spine in a more neutral alignment. And one more detail many people miss. Keep your head centered, not tilted sharply to the side, not twisted into the pillow. Straight and neutral, as if your nose were pointing directly toward the ceiling. Now here's the warning I always give. Supported back sleeping is very different from stomach sleeping. One maintains alignment and airflow. The other twists and compresses. After 60, stomach sleeping is still the position I would avoid whenever possible. And pay attention to your mornings. Do you wake up with heavy-headedness, tingling in your arms, dizziness when standing, a racing heartbeat, or signs of reflux? Those are not just random annoyances. They are feedback from your body. If you have heart disease, prior stroke, uncontrolled blood pressure, or unexplained nighttime symptoms, this is also a conversation worth having with your doctor. Bring details. Describe your sleep posture. Mention your morning symptoms. Because sometimes the smartest health conversation begins with a simple question. Is the way I sleep helping my heart or making its job harder? And before we close, I want to leave you with one final truth that could change how you think about sleep forever. So let me leave you with the truth I wish more people understood before a crisis ever forced them to learn it the hard way. Sleep position is not just about comfort. It is mechanical support for the heart, mechanical support for the brain, mechanical support for the blood vessels that have to keep carrying life through your body all night long. And after 60, that matters more than most people realize, because the real goal was never simply to sleep a little better. The real goal is bigger than that. The goal is to protect blood flow, to protect a clear mind in the morning, to protect your balance when you stand up, to protect your independence, your confidence, and your safety over the years ahead. I've seen too many serious problems begin with small things people thought did not matter. A little strain here, a little pressure there. A habit repeated for years with no warning sign loud enough to make someone stop. That is how the body often works. Big events are sometimes built on small patterns. That is why I want you to take this seriously tonight. Not fearfully, but wisely. So tell me in the comments, what position are you going to change first? Are you going to stop sleeping on your stomach? Are you going to start training yourself to lie on your left side? Or are you going to set up a safer supported position on your back? And please share this with a parent, a spouse, a sibling, or any older loved one who has high blood pressure, morning dizziness, reflux, or a history of feeling off after sleep. One important medical disclaimer before we close. This content is for education only. It is not personal medical advice. Do not stop, change, or reduce any medication on your own. And please speak with your doctor, especially if you have heart disease, a history of stroke, sleep breathing problems, or unexplained nighttime symptoms. Tonight, give your heart a better position to rest in. Sometimes that small act of protection is where a safer future begins.